My name is Chantal Migone. I'm a specialist in public health medicine at the National Immunisation Office. This presentation is to support you in communicating about COVID-19 vaccines to women who may be hesitant or undecided about vaccination. Healthcare workers are the most trusted source of information about vaccines, and you as a healthcare professional, as a doctor, a midwife or a nurse, are key to vaccine acceptance. So your recommendation and your communication about vaccination can make the difference in terms of accepting a vaccine in somebody who's undecided. And there's really good evidence of this, and the World Health Organization considers healthcare workers and their recommendation regarding vaccination as key to addressing vaccine hesitancy. In Ireland, we've had high vaccine uptake across age groups, and our surveys of the population consistently show high acceptance of COVID-19 vaccines. However, we've more limited data specific to pregnancy, and we have seen increased numbers of pregnant and postpartum women requiring treatment in ICU because of COVID-19, the vast majority of whom are unvaccinated. COVID-19 in pregnancy can be associated with severe disease and complications in pregnancy, including preterm labour, premature delivery and stillbirth. So what do we know about vaccine hesitancy or indecisions about vaccination? Well, we know that the vast majority of people who are hesitant about receiving a vaccine are actually undecided about vaccination. It's a very small proportion of people who are adamant and strongly refuse vaccination. So this presentation is really focused on communication with those people who are unsure or vaccine hesitant or undecided. Vaccine hesitancy is complex, and it's context specific, varying across time, place and about vaccines. And it's influenced by three things. One is complacency, one is confidence, and one is convenience. So confidence is the confidence that the vaccine is safe and that it's effective. Complacency is complacency about the disease itself that's prevented by vaccination. So for COVID-19, somebody may think that perhaps for them, COVID-19 is not going to be a severe illness. And then there's convenience and constraints. So we know that the more convenient it is to get a vaccine, the more likely people are to be vaccinated. So if it's difficult to get to a vaccination clinic, it's opened at inconvenient times, maybe you don't have a car to get to the appointment and it's far away, then all those things can affect whether or not you will accept a vaccine. And if you're undecided or unsure, if it's inconvenient to get a vaccine, you're less likely to get a vaccine. There's two other C's. One is collective responsibility, so people's perception that they're doing vaccinating, they're getting a vaccine to protect others in the community. And then there's calculation, the degree to which people look up lots of information about vaccines. So what influences an individual's decision about vaccination? Well, it's really complex, and it's affected by many things, including, for example, the historical, political and socio-cultural context. So there may be mistrust of government and mistrust of institutions, which can affect a person's individual decision making about vaccination. There's public health and vaccine policies, there's communication in the media, including what's seen in the internet and social media, and anti-vaccination activists. But you can see there on the right health professionals' recommendations, and these are really key in a person's acceptance of a vaccine. So when we're communicating about vaccination with somebody, it's important to know how a person makes decisions about vaccination at an individual level. So we're not necessarily driven by facts, data and statistics when we make decisions about vaccination. So this is important, because when we're communicating, our instinct as healthcare professionals is to give the facts, give the data, give the statistics. But actually people's decisions about vaccinations are not necessarily driven by this. So rather we see what we believe rather than we believe what we see. And we're strongly influenced by what other people are doing, so about social norms and whether other people are being vaccinated or not. We prefer anecdotes and stories to facts and evidence, and we tend to pay more attention to negative information than positive information. So all of these are important to consider when we're communicating with somebody about vaccines. And it is really important because, as I said before, there's really good evidence that how you communicate with somebody about vaccination and what you say if you're a healthcare worker really matters, because a skilled communication can make that difference in accepting a vaccine. So what works and what doesn't work? Well, the World Health Organization recommend a conversation which is skilled and respectful and designed to build trust in vaccines and is based on motivational interviewing. And motivational interviewing is a technique that's used for other interactions. It's used, for example, in smoking cessation and in addiction. And it's really designed to work with the person to move that person to change. So in this case, move that person to accept vaccination. What doesn't work is bombarding people with data, research and evidence. So counterintuitively, if somebody's undecided about vaccination and you give them loads of statistics about why it's important to get vaccinated, it can actually have a negative effect. And that's difficult for us to understand as healthcare workers, because we're so driven by data, research and evidence. But as I said before, the way people make decisions about vaccines is not necessarily with that rational data-driven part of the brain. The other thing that doesn't work is entering into prolonged debates about vaccination, and also debunking myths about vaccination that the person hasn't specifically brought up as a concern doesn't work, and in fact may help propagate the myth. So if somebody hasn't brought up a specific concern, it's best not to bring that up because it may help propagate the myth. Other things that work apart from communication is making access to vaccination convenient, as I said before, and also reminders also work. So getting back to communication, when you're interacting with somebody about vaccination and they're unsure about vaccination or they haven't been vaccinated, the first thing is, where are they on the vaccine hesitancy or on the vaccine acceptance continuum? So as I said before, the majority of people are undecided, even if they tend to refuse the vaccine, but they're unsure. And this number of people who are adamant that they don't want the vaccine is actually very small. So first of all, if you've established that somebody is there somewhere in the middle, they're hesitant or they're undecided, you're going to have a conversation based on motivational interviewing. So what are the principles of motivational interviewing? Well, first of all, before we start, something to note is that sometimes people say, I'm really busy and I'm seeing lots of people in a clinic and I don't have time to engage in long conversations, counselling, etc. But actually, a motivational interviewing technique doesn't mean that the conversation about vaccines is longer. In fact, the conversation can go much more smoothly and can be much less time consuming and less frustrating and much more productive. So it's not that because you're using motivational interviewing techniques, it's going to take up a lot more time. So the principles are, the first is asking open-ended questions. Somebody who says, I'm worried about the vaccine, I don't think I'll get it. Asking about their concerns about getting the vaccine. What are your specific concerns? And this is important because if somebody says, I'm not sure I'm going to get the vaccine, I'm not sure that it's safe, and you launch into a conversation about how the vaccine is safe in pregnancy for the baby, but actually their specific concern is about blood clots in pregnancy, then you haven't addressed their concerns. So really important to ask open-ended questions about their specific concerns. The next thing is to reflect and respond. And that's really reflecting what they've said. So I'm afraid it isn't safe. Well, I understand that you want to make the best choice for you and your baby, but that you're worried. The third is to affirm strengths and validate concerns. So this doesn't mean that you're agreeing with what they're saying, but you're affirming their strengths about what's positive about what they're saying and validating the fact that it's okay to be worried. So for example, they said, I've read online that the vaccine can cause problems to the baby. Then affirming the strengths is great that you're thinking about vaccines, and validating their concerns is that it can be worrying when you read things like that online. Then ask, provide and verify. So ask what they already know about COVID-19 vaccines and ask what they know about COVID-19 infection in pregnancy as well. Based on what they've tell you, provide information and ask if you can provide that information based on the information that you've just they've just shared. And then verify what their understanding is after that conversation and how they view things now. And then summarise and describe the action. So based on our discussion, you've said that you decided that you'd like to read a little bit more about the vaccine and talk to your GP, and you're going to make an appointment with your GP when you get home. So just looking at a sample conversation then, we have Sarah, midwife, and Aoife, a woman attending for her antenatal appointment. And Aoife hasn't yet had the COVID-19 vaccines when Sarah asks about it. And remember, really important to engage in that conversation about COVID-19 vaccines, because you can imagine if you're somebody who's undecided about vaccination in pregnancy, and when you go to your appointment, nobody asks you whether you've had the vaccine, it's not going to make you want to get the vaccine anymore. You're going to consider that maybe it isn't so important because the person seeing you hasn't brought it up. So how to proceed? The first thing is be respectful and open. Ask the open-ended questions. Aoife says, I'm not sure that the vaccine is safe. Can I ask what you're worried about in particular? Affirm strengths. So if Aoife says, I've read it could cause problems with a baby, like miscarriage, and so it might not be safe, you acknowledge and you validate Aoife's concerns. So it's good that you're looking for information about the vaccine, and it can be worrying when you read things like that online, of course. Reflect and respond. I understand that you want to make the best choice for you and your baby, but that you have concerns about the vaccine being safe for your baby and that it could cause miscarriage. Ask, provide and verify. Could I check what you know about the vaccine or what you know about COVID-19 infection in pregnancy? And then when they've told you that, based on what you've told me, I wanted to share some information with you about the vaccine and COVID-19. Is that okay? And then you provide that information to her. And then you verify that that she has understood the information and also how she views things now. And then summarise and describe the action. Stress the positives. So remember to stress those positives about the vaccine, that it protects against serious disease and can protect against those complications of COVID-19. What can be really helpful is what's called storytelling, and that's really sharing your experience. So this is particularly effective if you're somebody that the person can relate to. So an example of that is if you're the same age as the person, for example, or from a similar background. Sharing your experience can be really effective. So for example, saying something like, well, I read up about the vaccine as well, and I talked to my doctor and I was happy that it was safe and I got the vaccine and I'm really glad that I did. Point to other sources of information and reliable sources of information, such as from the HSE or from the WHO, and where Aoife could find more information about the vaccine. And remember to recommend the vaccine. I recommend the vaccine for you is really powerful if you're a trusted healthcare professional. So what about those people who are adamant that they don't want to be vaccinated? Well, these conversations can be very frustrating, and then they can take up a lot of time. And I'm sure we've all had conversations like this that can be really quite stressful. So how to proceed? Well, there is a way of having these types of conversations. So the first is to remain non-judgmental, even if what they're saying you strongly disagree with. So saying something, well, I can see that you feel strongly about this and I know you want to do the best for your health. Ask permission to discuss. Would it be okay with you to talk about vaccination against COVID-19? And if they say no and they're adamant that they don't want to discuss it, well, then leave it at that. There is no point entering into a debate or an argument about vaccines. If they do say that it's okay, well, then offer information and use the approach that we previously discussed based on motivational interviewing. But if you can see that it's entering into a debate or an argument, saying something like, well, I can see that you feel strongly about this, rather than continuing into a prolonged debate, is more productive. The goal here really is to leave space for any future discussion and to maintain the relationship with the person so that the door remains open. And if they ever did want to come back to you and talk about vaccines, that relationship is maintained and that they feel that they can do that. And also that they can come back to you and talk to you about COVID-19 infection itself, if they have any concerns. So really to maintain that relationship is the goal here. So then moving on about things that we may be asked about, which is what is the evidence for the safety of COVID-19 vaccines in pregnancy. So I'm not going to go into detail here. There's really fantastic, much more detailed resources available, which I'll go through in the next slide. But basically, pregnant women were not specifically included in the initial clinical trials of COVID-19 vaccines. And this is partly because it's difficult to recruit pregnant women, more difficult to recruit pregnant women to vaccine trials, and also for historical restrictions on including pregnant women in trials of vaccine. But there are currently studies underway looking at COVID-19 vaccines in pregnancy. However, even though they weren't included in the initial clinical trials, since the rollout of the COVID-19 vaccination programme across the world, hundreds of thousands of women worldwide have received COVID-19 vaccines in pregnancy. And there is a lot of data available from a number of countries and a number of studies. And there's data particularly available for the mRNA vaccines that we're using in pregnancy from the US, from Israel and from the UK. And all the information that we have has shown that there have been no unexpected pregnancy or infant outcomes observed in women who received COVID-19 vaccination during pregnancy. All the available data do not indicate an increased risk of miscarriage, birth defects, stillbirth, intrauterine growth retardation or preterm birth. And as I said, there's further studies being carried out on COVID-19 vaccines in pregnancy that will give us more information. This is just a slide which shows a brief summary of the evidence that's currently available. It's taken from those resources which have been developed by the Institute of Obstetrics and Gynaecology, the RCPI, NIAC, and the National Women and Infants Health Programme, and they're available on immunisation. The link is available on immunisation.ie, and they're available on the RCPI website. So, as I said before, just refer to those because they're really fantastic. They're really fantastic for you when you're talking to women about COVID-19 vaccination and pregnancy. But they're also really great. Women can read those, and there's different levels of information. So it's a layered approach. There's more detailed questions and answers which go into much more detail about the research. There's also an infographic which is much simpler with simpler language and more visual aids. There's a decision aid. And there's some get the facts leaflet as well. And we also have more resources in terms of communication and the motivational interviewing and addressing vaccine hesitancy on immunisation.ie. So in summary, you as a healthcare professional are the most trusted source of information on health and about vaccines. Your skilled communication about vaccines really matters. Because it can strongly influence somebody who is hesitant about vaccines in accepting vaccines. Thank you.